Now, health campaigners in Dorset are calling for dozens of community hospital beds that were closed to save money to be reopened to help provide extra capacity for coronavirus patients. The group Defend Dorset NHS say beds lost at Portland, Wareham and Ferndown could be cleaned and ready within a couple of days to relieve the pressure on already stretched emergency hospitals in the county. Some local councillors in Dorset have welcomed the call. Others say this is not the time. We can talk through it with our Dorset political reporter Tristan Pascoe, who joins us first up. And Tristan, what exactly are health campaigners calling for?
Steve, good morning to you. Defend Dorset NHS is the local campaign group we've been in touch with many times over the last 5 years, for example, over the plans to reorganise health services in Dorset, particularly the moving of A&E and maternity from Poole to Bournemouth. As part of their researches, they've done an awful lot on the number of community hospital beds that have been closed in recent years to save money, and they say now is the time to reopen them. The group says in the last 10 years alone, 116 community hospital beds at smaller units across the county have been lost. 74 of those beds lost in the last 18 months, including all beds at Portland, Wareham and Ferndown, and half the beds have been closed at Bridport. Now, Giovanna Lewis from Portland is a spokesperson for Defend Dorset NHS. She told me getting those extra beds back on stream right now is critical.
Having 74 more beds could make an enormous difference. We're calling for trust managers to open the community beds that have been closed within the last 18 months, and we're asking MPs and Dorset councillors to support us in that call to get those beds reinstated. We're concerned that people are being discharged from hospitals sooner than they might otherwise be because of this shortage of beds. 18 months ago, we had 74 more beds in Dorset than we have now. We need to get them reinstated, reopened and supporting the community as soon as possible.
Giovanna Lewis from Defend Dorset NHS there. Tristan, what does the NHS in Dorset say in response?
Well, we had a statement from Dorset Healthcare, Steve. It says, I quote, "We're doing all we can to protect the public and ensure essential services continue at this challenging, exceptional time. This includes considering how we can best organise our resources and where and how we might be able to increase bed capacity in the county should it be needed." The statement says, however, we must ensure these beds are in the most appropriate locations and safely staffed with the right equipment and facilities to hand. We're working through a range of options so that we're fully prepared as the current situation unfolds. Now, that letter sent by Defend Dorset NHS campaigners calling for these beds to be reopened was also sent to all Dorset Council members and has produced a mixed response. I spoke to one yesterday, Councillor Les Fry from Dorchester, replying. He said in his email he was very disappointed to read this and feel that your timing is extremely poor. It's wrong for anyone to make political gain and distract staff from their current vital task. Others, for example, like Green councillors Claire Sutton and the Weymouth GP Dr John Orrell, as well as Lib Dem councillor Nick Ireland, have welcomed the suggestion. And some crumb of comfort, if you like, for campaigners. The portfolio holder for adult social care and health at Dorset Council, Laura Miller, says if it becomes necessary to use those community beds to which you refer, then we will of course look at this very carefully, Steve.
Tristan, thank you. You mentioned Nick Ireland there, Liberal Democrat councillor. He joins us on the line. Nick, good morning.
Morning, Steve.
You've got wife and daughters that work in the NHS on the front line. Their experiences so far?
It's slightly mixed, actually. My wife works at Yeovil District Hospital, and they're effectively waiting for it to hit them. Whereas my daughter works at Imperial College in London, at St Mary's in Paddington, and
Well, we seem to have lost the line to Nick there. I tell you what, we'll try and get him back. Nick, I don't suppose you can hear me.
I'm here.
Excellent. Sorry. Thank you. Sorry, you're just talking about your daughters at Imperial College London.
yeah, she's right in the thick of it. They're losing lots of, unfortunately, people every day. 10 to 20 patients are dying every day, unfortunately.
Awful. I'll cut to the chase because I'm concerned we might lose the line for one reason or another. But these beds, reopening them, is that really the sensible approach to tackling coronavirus? When you look at something like what's happened at the Excel Centre in London, the focus seems to be on locating as many people as possible in the same place so that they can be treated, in a concentrated mass almost.
Well, there's an estimate of 4,000 critical care beds needed in the southwest, and I don't know where they're going to come from. We shouldn't forget that there are patients out there who will need convalescence after recovering from COVID-19, and there are patients out there suffering from other illnesses who still need beds. So if it's the right thing to do, then we should be reopening beds where possible. And I trust that the people who are looking at this won't use political or past histories to make that decision.
Yeah, and is there anything that you can do, or as a council can do, to try to make that happen? Do you feel that's within your gift?
Well, I'm actually a governor of Dorset Healthcare now, as a partner governor in my role as a Dorset councillor. So I did contact the chief executive of Dorset Healthcare, who obviously run Portland Hospital, etc. And basically the answer was, at the moment, no, they're not going to reopen. They are looking at critical care capacity. I do think they need to look at capacity for other patients. Dr. John Orrell has already said that, a bed is a bed. It doesn't really matter where it is. If there's a need, we should be providing it.
All right, well, look, keep us updated. Really good to talk to you this morning. That's Councillor Nick Island, live with us on BBC Radio Solent.